My name is Juan Abraldes. I am a hepatologist at the Hospital Clinic Liver Unit at the University of Barcelona. And we have been invited by the editors to discuss our paper on the prognosis after variceal bleeding in patients with cirrhosis. Variceal bleeding is one of the most serious complications of patients with cirrhosis. It has a mortality of 15 to 20%. And if these patients are left untreated, the risk of rebleeding is extremely high during the first year, about 60%. The current recommendation is to treat all patients with the combination of non-selective beta blockers, propranolol or nadolol, and endoscopic band ligation. However, with the generalization of primary prophylaxis for variceal bleeding, an increasing number of patients are already on beta blockers when they experience their first bleeding. The optimal therapy for this patient has not been specifically evaluated in randomized trials, and the current recommendation is to add endoscopic bundle ligation. Therefore, the purpose of our study was to evaluate whether the prognosis of these patients who are already on beta blockers when they first bleed is different from that of patients who were not on primary prophylaxis when they experienced the first bleeding. We recruited 89 consecutive patients with the first episode of acute variceal bleeding that recovered successfully from the bleeding and initiated secondary prophylaxis or received non-selective beta blockers and endoscopic bundle ligation. 38% of these patients were taking beta blockers when they experienced the bleeding, while 62% were not. The baseline characteristics of these patients were comparable, except for a higher proportion of alcoholic patients in the group not receiving primary prophylaxis. The main results of our study were that those patients who were already on primary prophylaxis with non-selective beta blockers had a double risk of rebleeding and death on the follow-up as compared to those patients that were not on primary prophylaxis. In addition, at multivariable analysis, previous failure of beta blockers was independently associated with the risk of rebleeding and death. So therefore, in summary, what our study shows is that the patients that bleed despite using beta blockers in primary prophylaxis are a distinct group of patients with a high risk of rebleeding and death despite the addition of endoscopic bundle ligation to their treatment. Therefore, this suggests that these patients should receive more effective therapy. This could be new, more effective drugs to decrease portal pressure, or maybe the use of transjugular intrahepatic portosystemic shunt. And this should be evaluated in appropriately designed randomized controlled trials.